Good morning, everybody. Happy Wednesday. You made it. We're here. Hello, hello, hello. How's everybody doing? Hello, Gen X. Angel. Hello, Jeremiah. Hello, my friends. It's been a wild day. It was looks like El Said officially, I forgot to change this. Dang it. I mean, it was barely a win. It's kind of sad that it was barely a win, but it was barely a win. And almost all of the Republican ballot initiatives failed. Heck yeah. Good morning, Kevin. How are you? Gonna be a rough go against the Republican for him. Talked a lot of shit about Whitmer and Stevens. I mean, we'll find out. A lot can happen in 3 months. But yeah, we'll see if it's a rough go. See. Good morning, OC. How are you? I can't wait to go vote in the Minnesota primaries next Tuesday. Good. Yes, Linda, I just went live. He does realize that he is working on that now, but yes, it's an issue that he. You know, here's the thing is I think people are tired of politicians not being straight. I know I am. How are any of us going to actually know who we're voting for if we can't hear the people saying what they think? I don't know. It's not an easy thing. I mean, I think there's a lot of valid shit to be said about Whitmer and Stevens. So, I don't know. Food, water, shelter, education, healthcare, basic stuff. Yep. Totally agree. Yeah, we had a guy come in yesterday that felt that these kind of things should not be considered rights for all people. How am I feeling this morning? I'm okay. Like I said, it's kind of rough to have people that I really thought would do a great job in Congress lose. But that's the unfortunate reality of life. You know? This is a long haul thing we're doing. This isn't something that's going to get done. Did anyone win that I interviewed? Yeah. Jordan Herrera in Missouri won his primary. Carrie Barr won her primary. Callie Barr, not Carrie. Callie Barr won her primary in Michigan. I think those are the only people that I interviewed in this election cycle. Missouri amendments 4 and 5 both failed to pass. Let's see if the governor overturns the vote again. You know, never a dull moment, right? Mike Lindell gave up his MyPillow position to focus on his race. I swear, some of these people have no. I don't. The mentality of someone who has done nothing good and been able to do nothing. What do you mean? How's democratic socialism working out in Spain? All of Europe is moving right. No, they're not. No more than America is moving right. They haven't had his primary yet, Frank. They absolutely aren't. People that have always been conservative speaking up and speaking out does not mean that a country is moving right. It means they're willing to speak up. Okay. Okay. Good luck on that. My state has had ours yesterday, and the governor is mad about amendments 4 and 5. Hey, you know? Oh, Missouri? Yeah. Yep. El Said won. Yep. People should stop making assumptions from a headline and do research. Very true, Kat. Very true. See the Republican in North Carolina drop down. For what? For senator? Shut up. Establishment is big mad today. True, they are. Chuck Edwards ends his re-election following harassment allegations. Oh, so someone running for re-election. Gotcha. Well, good. Nice. Glad to hear it. That's awesome. Love it. Perfect. But yes, Cusp, the establishment people just broke, didn't know if you knew. I didn't, David. Thank you for letting me know. Yep. No, that's awesome. That's what we need more of. If only that the guy who's being accused of assaulting his wife would do the same. Wouldn't that be nice? Progressive won, man. Did it, Scott?
Yeah,
Barely.
a lot close. Yeah, he won. It's a lot closer than we thought it would be. Philip made a good point over on the other side. This is going to be a tougher race than we thought it would be in November. So be it. There are the questions that we talked about at the beginning of your live last night, Mike. So far, progressives have not broken through in anything but deep blue, wealthy, highly educated districts. The issue is, does a progressive have legs anywhere else? Well, that's partially answered last night because this was a statewide election in a purple state, not a deep blue state, and a progressive won. In the same token, the progressive won by a lot less than we thought they would win. So maybe the question is still in the air, and now on to November. The issue for El Said is precisely partially what Philip pointed out on the other side. He's going to have to make a reach out to moderate voters and liberal voters. And I think that won't quite be the problem that people think it is because of the nature of a midterm election, which is a referendum election. People are voting up and down on Donald Trump. They're not focusing on who the Democratic nominee is. That will really work towards El Said's candidacy, especially in a pretty evenly divided state. You take an evenly divided state and then you add 8.5 points to the Democrat side, which is what the generic ballot is at right now. And that's what the Democrats are going to win the midterms by, is 8.5. That should put him in good position. But does he have fence mending, party unity work to do? Yeah, sure he does.
Yeah, and places like AIPAC dumped in so much money. They spent $64 million on the primary.
Well, was that 30 million towards 64 nationally and then 30 million? I know they spent 30 million on her.
Okay.
But you're saying it was 64 million on her alone?
I think 64 million was spent by her and PAC supporting her total in Michigan.
Yeah, I think 30. I think 30 million from AIPAC alone, which is a big buy-in from AIPAC. They would have had more fun if they'd have burned the money on their kitchen table because it didn't do anything. But again, mixed emotions. A win's a win. So that does count in American politics, folks. Close only counts in horseshoes. But it did show certain weaknesses in his coalition that a good politician will be able to solve. The other thing that works in his favor, again, is that this is going to be a referendum election, which means people will be focused on the Republicans. They're not going to be focused on whether he's reaching out to Stevens supporters. They're going to be focused on the big prize. And I tend to think that Stevens supporters are not going to say, "Oh, well, our person didn't win. We're going home." That's not going to happen. They hate the Republicans. They're going to come out and vote.
No.
So I don't think it's as big a problem as people are going to be making it today. But I think if you look in both social media and mainstream media, they're going to be emphasizing the fact that he underperformed, that maybe he's in a weak position. I'm not so sure about that because, again, people are going to be focusing on the Republicans. And the second factor here is that he is a talented politician. Stevens was a great workhorse and still is a great workhorse for the Democratic Party. But she's not flashy. She's not articulate. She's not a good campaigner. This guy is, I mean, just listen to him speak. You don't have to take my word for it. Just listen to the guy. Whatever it is, he's got it. So he's a good politician. And I think if he wants to triangulate, he has the political skills to do that quite easily.
Piper, you don't seem to understand the purpose of my statement. Healthcare is a human right. I don't think healthcare should be free. It wouldn't be free no matter what. People are paying for it, whether it's single payer healthcare or through that where the only quote unquote insurance is the government or not. The problem is it's unaffordable. So even if you have a job, people can't afford it.
Yeah, Mike, Linda makes a very good point in chat. She says, "I do have concerns as to why it was close." Linda, it's fair to have those concerns. It's very fair. It's closer than we thought it would be. And you have to take a look at the national environment, Linda. Progressives have won about 20%, according to Nate Cohn in the New York Times, who analyzed every single election that's taken place so far. They've won about 20%. More mainstream establishment Democrats have won about 80%. The Democrats have only won the progressives have only won in heavily wealthy, deep blue, highly educated districts. Well, Saeed just broke that. I mean, Michigan is a mini microcosm of America. They have more non-college educated voters than they have college educated voters, and Saeed won. Did he win by as much as we would have liked to really put a stake in that trope that they can't win outside of progressive districts? No, but he won. So that has to be, from the progressive standpoint, rather encouraging because it's the first time they won statewide like that in a purple state. And now we'll see what happens next week in Wisconsin when I think that they're going to win again. And that should open up the floodgates a little bit. So I'm not as worried as people are saying because I think the Democrats are so desperate to win in November that they would coalesce around anybody. And I think they will.
Don't pay $800 a month, not including dental and vision. What are you talking about? And people right now wait 8 months for a doctor. It's because there aren't enough doctors. I don't think you understand how universal health insurance works. I'll send it to you. Send it to We've got people that live in Canada in the chat right now. We've talked to some of them. We've had them up here and they've talked. Actually, no, and Mac, he wouldn't. Not even a little bit.
I think that there is a huge misconception about work and health insurance there is a extremely large percentage of people who do work who are not offered healthcare. Your work is not required to offer you healthcare in many situations, let alone people who get their work to pay for all of their healthcare. That's probably pretty rare now at this point. So to tell people just to get a job is not an accurate picture of reality in this country.
Yeah, that's a good point. And by the way, going back to Linda's point, one more thing that somebody in chat also brought up. God, we have a good chat, don't we? Keep your eye, folks, on Wisconsin. Keep your eye on Francesca Hahn. It hasn't gotten the same amount of attention as this election has, but it's every bit as important. And it will give us a good indicator again as to how widespread this movement is. So that comes up next week. Keep your eye on that race.
Sure you do, Mike. Just because your company or whoever you work for is willing to cover more of the cost for you has nothing to do with the costs of insurance. No, it would not turn doctors into postal employees. Doctors would still be doctors, and they would go to our health insurance company, which would be Medicare if it were that or something else, to get paid, just like anything else.
Yeah, Mike, not Mike you, but Mike, the person who made the postal employees, I believe that was his name in chat. Do you believe that people on Medicare, the doctors who handle people on Medicare, are postal employees? Because that's analogous to universal health care. And I just don't see your point that it would turn doctors into postal employees.
Actually, universal health care would much more efficiently care for 340 million people than what we're currently doing. Medicare does not piggyback off the private sector. Medicare
Mike, do you know how Medicare works?
Is an insurance company. It is not healthcare. No, it doesn't. You guys don't even understand how our healthcare system works. And you're speaking out of your ass.
There is a reason why no other country in the world has copied us on our insurance healthcare system. And to talk about, 340 million people, do you know how many people are in China? I mean, it is, you have to use some critical thinking skills. You have to start thinking about more than what the propaganda has been telling you for the past 40 years. You have to start looking at statistics worldwide. We are a worldwide economy. Other countries do healthcare much better than us. Every single country that is on the level that we are in development does better than us in healthcare, and they're spending far less money on it than we are.
23% of the UK are not satisfied with their universal health care. Oh my gosh. Well,
that means that the other 77% are. Do you know how many people are unhappy with our healthcare system? I bet you almost 100%.
So over on Twitch, I got Real Amanda says, as a Canadian whose fam are doctors and nurses, it's insane to hear Americans rejecting public health care. LMAO. Canadian here. I don't hate my health care. I want more public health care.
Mike in chat says doctors lose money on Medicare. That's why they mostly accept private insurance. Mike, both of those statements are untrue, patently untrue, not even close to being true.
Yeah, and they're unhappy with it because they want more of the services. There are systems that have their own problems, but the reality is that their systems are still working better than ours. And of those people who are unhappy with their own healthcare system, none of them would want a healthcare system that America has. They
And
still want universal healthcare.
and just because in your correction, 23% of UK are satisfied with their universal health care as it currently stands, you think that means that they would rather go to full private that they would all go to full want to go to full private health insurance? No, they wouldn't.
Yeah, you
Guarantee
say
they
that they're
wouldn't.
unhappy, but they also would never, like, they laugh at Americans. They think we are absolutely insane.
Do the Republicans flavor their boots or something? Yes. Yes, they do.
And not only, I always say this, putting aside even like the moral and ethical standpoint behind universal healthcare access, because we know that Republicans in general really don't care about the moral and ethical reasons behind it. Just look at the financial reasons behind it. Financially, it makes far more sense. It is a far cheaper system than what we currently have.
And why are they struggling there? Because they're trying to run in many ways a unregulated capitalist system with universal healthcare. The problem is unregulated capitalist system, not universal healthcare. Universal healthcare does not decrease incentives in health science and research. That's idiotic. That is literally the dumbest thing you could say.
But where are you coming up with that, Mike Brennan?
That
Where are
is
you coming up with that? I
universal.
mean, where are you coming up with doctors don't accept Medicare? Where are you coming up with, uh, uh, makes them postal employees?
Healthcare research is funded by the government. It is not funded by private companies. All of our healthcare research in this country is literally funneled through the government, which is funneled through universities. It's not private companies and capitalism making our healthcare system better.
We are not talking about you hear universal health care and you think that that means everyone is under the government. That's not what we're saying. We're talking about the health insurance side of things. Single payer health insurance. That means instead of all of us paying a private corporation to decide what kind of health care we get, we all pay into one big ass pot. The doctors are still private. Why can't you get that through your heads?
I promise you that the doctors and scientists that are doing research through universities are not wealthy like you think they are. I promise you that. The majority of doctors in this country are not as wealthy as you think they are. Are they doing okay? Sure. But primary doctors and the majority of doctors are not as wealthy as you think they are, let alone the amount of debt that they are in. I promise you nurses are not making the money that you think they are.
Students do not go to school to become doctors so they can make millions. That is the dumbest thing I've ever heard.
And this is where we have an issue with reality and voters like Mike in the chat. You're not in tune with reality. I'm not sure exactly how old you are or where you get your information, but you really need to start doing research like with reputable sources before you start coming at people with an opinion, because your opinion is so far past reality that it's actually really sad.
And again, this shows ignorance in what it actually means to work, what is entailed in working in healthcare. Not only, so doctors get paid $200K a year. Great. They also have the highest education debt of basically any other person out there. They also have the highest insurance just to do their jobs of anyone out there. It's not, they're not just taking that $200K and pocketing all of it. The reason that the money that they get is so much more is because their bills just to be a doctor are so much more. Not to mention the hours they work, the stress that they work under, all that other stuff is insane. They're not specialists. Sure, you get like friggin' plastic surgeons. No, it's not. What? Well, as people who have doctors and nurses in my family, yeah, it is. Oh my God. My dad just had a heart attack and triple bypass. This is the person in Canada. This is Amanda in Canada. And he's getting the best care, rehab, medicine, etc. We have no worries about medical debt. They also said all the preventative health care he's had leading up to this episode has contributed to his positive outcome. That's awesome, Amanda. Think for 10 seconds. Dude, I'm thinking more than you are.
Also, I think that, like, and this is pretty nuanced or in depth, but until you really work at a hospital and start learning the ins and outs and how much waste that we put into administrative paperwork, the waste and time that we create with so many different third-party systems just because we're only trying to get access to people who need things. I mean, I swear, like, half the job in the hospital and half the jobs in the hospital aren't actually to provide healthcare. It's to try to fight companies and insurance just to get people where they need to go and the aftercare that they need.
Tex, disagree. In a society where I believe all people, no matter your race, religion, gender, identity, deserve rights, respect, dignity, and safety, we are entitled to others' labor. Because that's how a society works. Everyone's labor supports everyone else. That's how society works. Because without everyone's labor, there would be no society, and we would all not be here anymore. I would also argue that corporations are practically getting free labor from the people that work for them in most cases already. That's why their friggin' profits are skyrocketing. Because there is no protection. There is no right to it.
Yeah, there's always going to be some people who choose not to work, but that doesn't mean that you damage an entire society and you punish everybody else for some people. I mean, and I just
Well, and okay, so Robert, what about people that are perfectly healthy and choose not to work? What about them? What about, you know, if someone is perfectly healthy and chooses not to work, and there's proof of that, then there should be repercussions. But that doesn't mean you just don't put in the protections for people. Right now, there is no protections for people. Healthcare isn't considered a human right. The ability to pay your bills and afford to survive are not considered a human right. Because if they were, then what you do is you put in mechanisms that make it possible for people to afford to survive and have, heat and hot water and have food and have health care and things like that. And if there are people that are manipulating the system and you can prove it, then they are held accountable. Where right now, when anybody talks about giving people things that I consider are human rights, like health care, they go, oh, well, what about the people that don't do it? What about it? We already don't hold people that we aren't even holding our politicians accountable. We literally have a president who's been found liable of SA, and you're sitting here talking about people that may be healthy and don't work.
You got to create an environment that encourages people to work too. I mean, you're going to get more people who want to go to work when you create a system that isn't forcing them to be in jobs that they hate, that isn't forcing them to rely on specific jobs for healthcare. You're
You know,
not, I mean, go ahead, Scott.
look, let's take a step back here and look at it in a macro sense. 15 to 20% of your healthcare premiums go as pure profit to the insurance company. On top of that is the very important point that Books just brought up, namely the huge amount of resources that are expended just in doing paperwork. That adds tremendously to the cost of our healthcare system. That would be eliminated. Look at it just in the dollars and cents. Leave the morality, as Book said a few minutes ago, leave the morality out of it for a second, just for arguing's sake. It's a cheaper system to have a national healthcare system. It's cheaper because you're eliminating the middleman and you're eliminating tons and tons of paperwork, which adds to the cost of healthcare. Thirdly, if you had a national healthcare system, and we've touched upon this, you aren't forced to stay in a job you hate. Think of the mobility that gives the American workforce. No longer are they locked into a job they hate just to have health insurance. Folks, point out the negatives to me, because I don't see any.
Tommy Bree, or whatever your name is, you are just talking. You're on here just talking. That's all you're doing right now. You're talking. You're whining and complaining. You aren't doing anything as far as I'm concerned. You're just in here whining. Just go get out on the streets. Go.
Papa said in chat that if we have national health care, we'll lose a third of our doctors. Where are you getting that statistic from, Papa? And by the way, don't we have Medicare, which is a national health care system for people 65 and older, and the doctors haven't quit over that?
No, you're on this live right now.
Expansion of Medicare has created far more opportunities and growth in healthcare jobs.
Especially Medicaid.
Yeah.
Rural hospitals depend upon Medicaid. Urgent care centers depend upon Medicaid. Ask yourself this. You don't need to be an economist to answer this question. Since the Medicaid cuts were announced and they won't become effectuated until 2 weeks after the midterm elections, so really about 10 weeks from now, 14 weeks from now, you have seen, since they were just announced, you have seen a bloodletting among urgent care centers. They're shutting down. Take a look at your own neighborhoods. Remember when urgent care centers were popping up like daisies all over the place? And now they're shutting down. There's a reason for that. They know that the money spigot is going to be cut off. These Medicaid cuts are going to cause a healthcare desert in rural America. That is coming. That is not my opinion. That is the opinion of the Rural Healthcare Association, which has said, and you can look it up yourself, folks, which has said that 50% of rural hospitals are going to face financial difficulties. 50%. Folks, this is crazy.
If you want, I mean, I think it was Mike in the chat earlier said common sense. Common sense is when less people have insurance, less people go to the doctor, which creates less jobs, and hospitals are closing. I mean, just as a prime example, I'm in West Virginia. West Virginia lost one of its big main hospitals closer to the southern part of the state. And they specifically came out a few months after that bill was passed and said it was due to future losses that they're going to foresee. That created a healthcare desert for OBGYN care and pediatric inpatient care. And now, down where our governor or our senator is from, people have to drive 2 hours to get to their closest hospital.
And what was it I saw? For the person who's like, you know, all the doctors would leave if this happened. Why would they leave? Why do you think they would leave? They want taxpayers' money, but also want what? Oh, I mean, maybe, yeah. Like where? Yeah, where do you think you just? Every doctor that I know would love universal health care, would love to not have to argue with 5 different and 20 different insurance companies just to get coverage for people.
That part.
I mean, I'm pretty sick and tired of seeing the majority of my patients come in with problems because they just can't afford their damn medicine.
Because they get.
And by the way, a more universal healthcare system would lead to better health outcomes. Let's leave the cost of it out just for a second. That is an economic benefit for the American economy. And I don't think people are focused on that. Sick people can't produce in the American economy.
And
there are just so many benefits to this, folks.
And Amanda, yes, unfortunately, most of the people that are against the idea of universal single-payer health insurance don't want to pay for others, but they're okay with benefiting from the exploitation of others. Yep. They don't actually want to fix the problem. It's not free, Tex.
It's and none of us up here are saying that it's free. We are asking to create a system where our current taxes and our current money that we're paying for the system goes to universal health care, to a one-payer system. All the money that companies spend on healthcare for their employees, all the money that we personally spend, even if we have insurance, and the money that we're spending on Medicaid and Medicare, it all goes to one pool.
Like literally, I don't understand why, for people that seem, oh my gosh, Tex, you
wow,
you're just a piece of shit. That's just fact. I'm
hey,
done
Books,
with
let
you.
me ask you a question. So, since universal health care is so evil and bad, and somehow I'm surprised we haven't seen the communism, socialism argument yet. How many major industrialized countries do not have national health care?
Well, I'm pretty sure that there are 87, I believe, countries that have some version of universal health care, give or take 5, depending on how you determine what is universal health care.
Yeah, the bottom line is every single major industrial country has a national healthcare system. So are they all stupid?
Brian?
And every single one has better outcomes on every single measurement that we can actually measure.
Brian?
That's quite correct. And overall, Books, let's go to the next point. Overall, our system, as disjointed as it is more expensive. in total dollars spent per health outcome.
Far more. 2
Exactly.
times more at least.
Exactly. We have an inefficient system now. This polyglycot system doesn't work well.
And
I mean, if we want to talk about waste, fraud, and abuse, that's one of our largest areas that we could fix.
Bingo.
and Brian, again, as we've said many times, it's not free. We're not asking, no one's talking about making healthcare literally free. We're saying all of that money that we're putting in to pay insurance companies, private organizations to decide whether we get healthcare or not, and pay for the stuff that doesn't get covered. Let's put a fraction of that, because we wouldn't be paying for profits. We wouldn't be paying, for companies' profits and all those other things. Put that into Medicare, all of us, and have things be covered. Folks are not moving out of New York City. Grow up.
We've never said free. We are asking that the money we currently spend be utilized in a different way.
Exactly, books.
It
They
does.
don't get that.
It does work. I don't know what you're saying doesn't work, but universal single payer healthcare does work, which is why most countries do it.
Brian, every major industrial country has a national healthcare system. It doesn't work for them. Is that what you're saying? That somehow they're stupid for doing that?
Just a question. You think health insurance companies are going to go to such a program? What do you mean? You think they're going to be okay with it? Of course they're not going to be okay with it, but I don't care what they think.
They're like the largest lobbyists against it. I mean, they spend more money at lobbying than almost any other industry, which is why we have such a big problem with propaganda.
Going from private health insurance to single payer health insurance has nothing to do with changing America. America has changed a lot.
By the way, that doesn't mean that you can't have your own insurance either. If you are wealthy enough and you want to buy private insurance, that's still a thing. You can still do that.
Well, I knew it would come, Mike. Brian now has thrown in the communist word. Here you go. You're batting 1,000, Brian.
How about start teaching healthy? How about paying a living wage so people can actually afford to buy healthy food? How about making it possible so people can not fear going to the doctor because of the bills that might come of it? How about doing all of the things that actually create a healthy society, not just sitting here saying, oh, you need to eat better. Well, people can't afford to eat better. People get what they can afford.
And funny thing is, you know which side of politics tries to create regulations in place and governmental departments that watch and regulate our food systems? Hint, it's definitely not the Republican side. So no matter what Kennedy tried to convince you guys of with this Maha movement, it's the exact opposite of what making America healthy again is.
Best advice is stop taking money advice from broke people. No. I would stop taking money advice from rich people because they don't know what the hell they're talking about. Loser attitude. Okay. Goodbye.
By the way, I have my graduation today.
Hell yeah. Congratulations.
Congratulations.
Thank you.
Bingo, Avalon. Good comment.
No. People that can't survive don't want everything for free. I don't understand why you can't understand that. Nobody wants everything for free. They want to be able to afford to survive.
And I like so I live in arguably one of the reddest states that there possibly is in this country. And I am trying my best to explain that not only do I want what's best for my liberal friends, I want what's best for the people in my state who are extremely red. People who are in rural areas, they do have it tough. It is hard to find access to good quality food and fresh food. It is hard to find access to good paying jobs. The politics only make it harder. I want people in my state to have access to healthcare. We're, I'm pretty sure, number one when it comes to Medicaid funding in all 50 states. We do not have access to good healthcare. There is now an over 10-year difference in lifespan between people who live in red states and people who live in blue states. We are not just fighting for people who vote one way. We are fighting for the rights of everybody to have better life outcomes.
You know, looking at the comments here, it is amazing how in depth the feeling is that this is a freebie. I don't believe Mike or Books or myself or anybody else in chat has mentioned the word free at all. In fact, quite the opposite. Folks, nobody's saying that national health care is for free. It would be something that we would pay. But it is a more efficient system because you're wiping out the 15 to 20% profit margin that insurance companies get. Just as importantly was the point that Books brought up is the huge amount of resources that are expended by hospitals and urgent care centers just to do billing, just to work that maze. The man hours involved in that is astronomical. That is a cost that is passed on. That's why our healthcare system is so expensive in the United States.
Hey, Deacon Stressy, how you doing, man? And I want to comment to the one person who said that to claim that healthcare is a human right is the same as claiming it should be free. No, it's not. To claim that it is a human right means to claim that it is affordable.
It's to claim that it's included in the social contract, and yes, obviously we pay for that.
Like society,
but it's a more efficient expenditure of our dollars.
It costs money to live in society. Like running a society costs money. Nothing is literally free. So why would I sit here and say that it's free? Sorry.
It is a human right. The child that is born with a severe disability who is never going to be independent on their own deserves to have access to healthcare. The same way that a construction worker who's in his 20s and doesn't have access to health insurance should be able to go to the doctor when he is sick or provide for his family healthcare access.
John B. Well, we've got plenty of people that live in Canada that would disagree with your statement of 26 to 36 weeks to see a doctor. So,
do you know that the wait time in my area to get mental health care is ridiculous. You're at least a 2-year wait list. But just for, say, a colonoscopy, which is something that is ridiculously, like, everybody needs it, or everybody should get one at a certain age. And it's a pretty fast and simple procedure. It's over a year wait list in my area.
Butterroll, I'm sorry, I don't bring up people that I don't know. It's a pretty hard rule. here. If you want to stick around, and I can bring you up another time, but it's a rule I've had for years now.
I mean, you can talk to the doctors in my area. I live in a rural area that does not have access to mental health care easily, and we have a 2-year wait list. Now, if you commit a crime, you might get access to health care a little bit faster.
I have no problem with opposition. We oppose each other in this chat often. That it's not about lack of opposition. I just don't. This is my live. I just don't bring up anybody.
I mean, and one of the reasons why I like your live too is that while we do have differences in opinion, we generally share a foundation of what we believe is morally acceptable.
Yeah. I tend to think that we all have the same goals and aspirations. Do we differ on the best way to effectuate those goals and aspirations? Absolutely. We differ all the time.
So there's there's plenty of opposition. I'm not going to talk to you if we're talking about something that goes against my fundamentals. There's nothing to talk about.
And with a name like MAGA Teacher, I'm sure that you can bet that they
gotten
go
muted
against your
plenty.
fundamentals.
Yeah, one of my hard, fast rules is if you don't believe that, everybody deserves access to food, then I have nothing to talk with you and debate with you about.
It's not that I can't debate. It's that in this live, we don't debate. It's not a debate. There's no debate.
Yeah, I think we share opinions, and I like to come here to learn from you guys too.
That when you come into my live, there's a little thing that pops up says we do not debate. Okay, Butterroll. Well, you would.
Oh, well,
you
MAGA
would know,
Teacher,
you
there's
would know
a good
about-
advertisement for you to get invited up.
You absolutely know all about that because that's probably your day to day. Same with you, gamblers.
Yeah, there's plenty of other lives that you can go to debate. We just are here to learn and to share our opinions on how to make things better for everybody.
We aren't crazy. Most of us see it. Again. Nice. I love it when people come in and just think that because what the perspective that they have come to makes sense to them, that means that they see something that we just don't, as though we've never actually had a conversation about it or talked with anyone or actually interacted with those perspectives.
My entire family is red. I am the black sheep of my family. If you don't think that I cause problems at every family gathering, you are sadly mistaken.
I'm not willing to argue in circles. I have quality things to say based on, again,
Well, why don't you start making some quality things?
you can say them, you can start saying them in chat, because your statements in chat, while in the beginning actually seemed like you wanted that, now seem to think that you just want to come up and be heard, have your ability to say them in my live on, have your voice be heard. I don't owe you guys anything. This will come in doses. That's fine. Progressive is literally how the country has worked since, how the world has worked since the dawn of civilization. There has been no civilization in this entire world that has not been progressive.
Well, Mike, their previous comment brought up the whole commie thing, so that tells you where they're going.
remove insurance from all healthcare. It will have to be a single payer system. Agree with that.
It's so weird to be called evil too when you're just talking about making sure that, like, kids are fed and people can afford their medicine.
Butterroll, that I'm going to be straight. The fact that you consider yourself a Kanye asthma gold Republican I'm not a huge fan of either of them. I think they are both pretty shitty people. But again, if you want to come in and I appreciate you being here and being willing to talk, but just understand that doesn't, I appreciate you letting me know where you're coming from. Why do they feel the perpetual? Because the internet has taught them that, because there are debate lives out there whose only goal is to bring people in to let them hear so they can have these debates, which aren't really debates. They are attempts at gotchas. Why would you be ashamed of Michigan? Bring on the progressives.
I don't get on debate lives anymore either, because I've just learned that, I mean, one, I used to do debate in high school, so it's like you said, it's not actual debate.
No.
And two, nobody's actually there to try to get things accomplished.
What's up, Tav? I want to
Exactly, books.
I want to answer Ash. So why so much fighting? I've never seen this in my life. I have no ill will towards Dems. I'm Republican. So, look, to an extent, it was always there. It was just kept in the quiet, kept in the background. We lived under the we don't talk about politics. That whole mentality was super strong. So why is there so much more outward fighting now compared to when, like, say, I was a kid? Couple reasons. One, I think it's more dangerous now than it's ever been. The internet and social media, by its very nature, causes more talking, which brings up a lot more pain and anger and fear, which causes fighting. But more than that, I think there is a disconnect when it comes to our fundamentals now between groups of people. We've had people that call themselves Republicans that come up, that have come in this chat and said that all people do not deserve equal protection. Like, straight up. Nobody knows what Jesus was. Anyone who says either, it doesn't matter. It doesn't matter. It doesn't matter. What do we want now? This is
there are I think that, like, for me, there's an extreme amount of hurt for me and disappointment in people who still vote Republican and they either purposely ignore things that they're actually doing, and laws that they're creating and how it affects people other than themselves, and or they just don't care because it doesn't affect themselves. As a woman, to be told what I can and cannot do with my body is so extreme and beyond what I could even imagine. I didn't grow up in that world. My grandmother had to fight for that right. And now she's gone, and now I have to fight for that again. To fight for my daughter's safety. And that's just one example. You know, there's laws that are being created that they're trying to force people to accept kids in schools who aren't vaccinated, whether they're a private school or a public school. I mean, Florida is trying to force the Catholic Church to accept unvaccinated kids when it goes against what they believe in. You have laws that they're creating or going through court systems where companies that are religious are saying they don't want to pay for certain things in healthcare, like AIDS medication, because they believe that it's a sin because they relate it to homophobia. And they won't allow people to have access to AIDS medication.
Butterroll, is there anything I disagree with? Yeah, I disagree with everyone having an account that they use for their care and their paying for their care and doctors. It puts an extreme amount of pressure on every person to never make a mistake.
And also can lead to the rationing of healthcare, self-rationing.
What if you are someone who, for whatever reason, get more sick, and you go through everything in there, but something else happens after you've used up your entire fund. But regardless of whether it's true or not, the next 10 years after, you don't. That doesn't help you right then. That's the problem. It's the same idea as it's the same problem as a lot of these other things that we're experiencing. Like people when people come in and they say they talk about the stock market and how good it is and how great their 401ks are doing. It doesn't matter for people that can't afford stuff right now.
Also, again, one of the biggest points about our system is the bulkiness of administrative work just to prevent people who you don't think should deserve access or more access than you need. Creating more paperwork makes the system more expensive and less accessible.
I may be MAGA, but I hate all corruption, and I appreciate that. You hope socialism. What's socialism? Yeah, no, someone's kid is not losing their life in the background tab.
Oh, sorry. That might be my kid screaming. I didn't know you could hear him from he's all the way downstairs.
I don't believe it would be cheaper and more accessible. It's kind of gaslight. No, that's your opinion. That it would be cheaper and more accessible. You think doctors, you think economists haven't considered these things before? You clearly explained how you believe it would be cheaper.
I mean, would it be probably better than the current system we have? Probably, maybe. I mean, if you're saying that everybody gets more of an access to it, sure. Which is one of the things that we talk about when we say, okay, we might have differences in opinions in how something could be done. But if you're saying that all people, it's still some version of a universal healthcare system, then yeah, it probably would be better than our current system.
The point for me is all of these systems that try and quote unquote give people the choice, in my mind, end up requiring more work by people, where people already don't have the time to do extra stuff because of how our country is. Why not just make it so people can go in and get health care? Why do we have to make it more complicated? Why does it have to be more complicated?
Yeah, I mean, isn't one of the examples that we use is like school lunches? We spend more money on administrative bulk to deny people access to school lunches than if we would just spend our money on buying lunch for every student in school.
So you want to turn being a doctor into a capitalist system too? Have you ever dealt with insurance? Yeah. How is a direct payment more of a hassle than that? Because it's not a direct payment. You're still getting money from a government. You still have to interact with the government, especially if you need more money. Competitive system. I don't want healthcare to be a competitive system in its own self. I want doctors to give the best healthcare they can give. I want them to care about me and my family and all the other people here. I don't want to think, oh, how much money can how much can I charge in order to make the most money to be able to survive, to be able to keep doing what I'm doing?
Yeah, why should we have to compete for basic healthcare? If you want the best of the best and you have the money to pay out of pocket for the best of the best or to pay for your own private health insurance, go for it. But that doesn't mean that everybody else should have to fight for scraps for their basic access.
Why would they be doing it for free, Detroit? Why do you think they'd be doing it for free?
There's doctors all over the world. There's healthcare workers all over the world. There are healthcare workers in this country who make less than people who work at Costco. I promise you that it's not gonna make less access.
Good morning, J-Man. How are you doing?
Fine.
Again, nobody wants it to be free. The doctors would still be private. Just instead of having to deal with where's the money for the services come from, our taxes, instead of our deductibles, instead of our payments to health insurance companies. It's a single payer health insurance system. A single payer health insurance system. It's not free healthcare. We are just not paying a corporation to decide whether or not we get healthcare, whose job is not to give us the best healthcare possible. It's to make as much money for their shareholders as possible. They're not in charge of healthcare. They are a health insurance company. I'm doing okay, J-Man. Some days the ignorance is just wild to me. And it's frustrating at times to be having the same arguments again and again and again because people don't want to listen. No, they don't take control. Again, this isn't new.
The best insurance, or one of, in my opinion, the best insurance that you can have is Medicare. At least they pay for stuff and you're not fighting for the most basic access because your insurance wants to deny you every single thing. And legally, they're allowed to basically do completely unethical things to try to weasel their way out of paying.
We are in debt trillions and you want to pay for health. We already do pay for health care, just privately. What does it matter where the fund that all the money goes in comes from. Right now, we are paying companies whose only goal is to make profit. Their goal isn't to help us. Their goal isn't to make us healthy. Their goal isn't to literally do anything that healthcare and health insurance companies are supposed to do. It's to make as much money as humanly possible. We already pay for people's unhealthy life choices, you idiot. Hey, Patty. Sorry, your money is more important. It's allotted to wars and shareholders. I know, Tav. It's wild. It's wild.
And Crystal, just so you know, ever since the opioid epidemic, regulations between pharmaceutical companies and sales reps and doctors are pretty extreme. Like, they're not even allowed to give us a pen. So doctors are not profiting off of that anymore. And if they are, it's highly illegal.
You guys seem to be under the weird idea that dealing with insurance right now is fast. Like, you seem to be under this weird impression that it's actually quick right now to deal with insurance. Why would society get healthier? Well, let's see. Let's talk about that. Having everybody put tax money, in this case tax money, into one pot would, by its very nature, cause our monthly payments as a whole to go down, so more people will have money in their pocket. Making it so people aren't worried about having to spend money via deductible every time they go to get health care would make it so people would be more willing to go when they aren't feeling well. Having health insurance not landlocked into a job would allow people to literally go get a job wherever they want and not have to stay in a crappy job just for the health care, which would make people happier, which would make people healthier. And that's probably just a little bit. Hey, Ducky.
You know, one of the biggest things that I see working in the hospital is that we have so many patients who come in and they have to stay inpatient like overnight for days at a time. And the reason is because they didn't take their medication because they couldn't afford it, or they didn't have access to therapy that they needed afterwards. And do you know the cost, like, that it would cost difference it would be to keep somebody out of the hospital for a week if we would have just given them access to the $30 bottle of insulin that they needed for the month?
No, but Alex, paying people a livable wage, having things be affordable, would more likely make it so they're able to eat healthier. Reducing the stress of people having to work a job that sucks just for the healthcare would make people healthier.
We have to start thinking about things in more of a way that is not so direct. You know, when we look at, just for example, to look at it from a different perspective, when we're talking about crime, we know that we can reduce crime better by creating better communities as a whole and without ever having to increase law enforcement or increase money into law enforcement. There's a reason why making people happier makes them healthier.
We have conversations all the time, Butterroll. That's different than a debate. What you and I are doing is a conversation. I'm okay with that. But when people come up to debate nowadays, it's just looking for gotcha moments. They don't want to be proven wrong. There's no listening involved. They want to come up and say their thing, and anything we say is going to just say, no, that's not it. So that's what we mean by you're not listening. Oh, I'm listening. You're guided by logic. I mean, life isn't just about logic. None of us are actually fully guided by logic. That's a lie. Everything that we experience, every perspective that we take, every angle that we do is based on our experiences, how we view the world, what, that we're all biased. No daily therapy. Did my bottom teeth hurt your feelings? Grow up. Maybe if we had universal health care. Only one of us is closing out other perspectives. I'm not closing out your perspective, Butterroll. I disagree with it. I disagree with it, and that's fine. I'm not saying that you are a horrible person for thinking it. I haven't blocked you or muted you. I disagree with it. I listened to you. I said why I disagree with it. I think some of your perspectives are from a don't work in the real world. It's not how I view society. It's not the way I think society should be. I don't like the idea of privatizing I don't like the idea of people having to deal with their own money for health insurance. I don't agree with it. That's fine. You do. You like it. That's great. He's jealous that you have teeth in your mouth. The idea of society is literally a fantasy. What?
How's it a fantasy, Butterroll? Every industrialized country has a national healthcare system. So how is what Mike's saying, whether you agree with it or not, how is what he's saying a fantasy? Where are you coming up with that?
Hey, Luna. Yes, congrats to Saeed. Logic is, in Spock's voice, illogical.
China has been around for how many years now? 4,000 years. They're not about to collapse. In fact, they're rapidly surpassing us.
Do they have issues? Yeah, they're dealing with some problems.
Of course.
Because they made choices that they are dealing with. Mostly, it sounds like lying about how many people live there, and because of the way they chose to do things, they're going to have some issues in regards to workforce as workforce gets older, but they're not about to collapse. Child labor. Where did anyone say we should follow them in the way we do child labor? Although there are people in this country that do think that we should have more child labor, unfortunately.
Also, people really need to catch up with the times. Like, is there probably some child labor happening in China? Sure. But China actually has stricter laws than many Republican states on child labor. Okay, so, if they're going against their own laws, that's one thing, but their child labor laws have changed drastically over the years, and they have stricter laws than many Republican states now do.
And again, do any of us here, I can't really speak for, but I think I know, do any of us think that we should be China? No. No, we should be America. But come on.
Do I think that we do many things better? Yes. Do I think that China does some things better? Yes. I'm not saying, like, we have to start looking outside of ourselves and stop thinking that we are the best at everything. Because the reality is, the lifespan and the quality of life of many people in this country is much worse than the average quality of life and lifespan in many other industrialized countries.
Yeah, China's put billions, if not trillions of dollars into environmental stuff too. Morning, Deb.
Why would I want to leave my family and home?
Like,
I want, you know, I literally live in an extremely red state. I want what's best for not only myself and my family, I want what's best for my neighbors.
I always grew up that our job as adults is to make this country better for our kids and our grandkids and our great grandkids. That means you look at what's not working and you say, how can I make it better? Well, healthcare not working. Affordability not working. There's a lot of things that aren't working. And going back to the way it was 20, 30, 40, 50, 60, in some cases years ago, is not going to make it better. Do I think that we need to take the UK system and bring it here? No. Just like I don't think we need to take the Canadian system and just bring it here, or any other system. No, deporting undocumented immigrants does not fix all of that and more.
Wow.
There are there things that we as a country could do that would prevent the increase, the necessity of hiring undocumented immigrants in certain cases in order to keep things affordable? Sure, there are laws that we could make. But that's a different problem. That's a regulation problem, or a lack thereof. Because we don't pay a living wage, because we don't make it possible for people to survive, companies are required to do things to keep the money, to keep costs down. And that means paying undocumented immigrants to do things and getting to pay them lower wages.
I mean, the Trump administration is removing protections for huge swaths of legal immigrants. And if you don't think that's going to have a massive negative effect to the healthcare system, you're sadly mistaken. We're going to have such a brutal effect on nursing home care, long-term care, long-term acute care centers. These are jobs that most Americans are not taking. They're primarily held up by legal immigration right now, and they're trying to send them back to their countries without any plan in place on how to protect those people who rely on their work.
We never, Eggsy, we never actually got rid of slavery in this country. Not fully. Our private prison system is slavery equivalent right now. So, I do think that it's horrible that companies, in order to survive, have to pay undocumented immigrants less than livable wages. I think it's horrible. And I think we need to do more in society. The problem right now is we blame immigrants for it. We don't blame the system. Actually, no, it is. It is literally. They are not really paid any wages. But
We do not have the population and unemployment levels to replace immigration. Immigration boosts our economy. This is a very simple fact. That's not what the Trump administration is doing, though. They are removing legal status from huge swaths of immigrant populations.
that are here legally.
They're not trying to get people here. They are trying to remove legal immigration.
My gosh. You guys just
No,
watch.
nobody said no borders. Nobody said that. Nobody said that. You're extrapolating that.
Look, we can sit here and I want to update our immigration system. I want to upgrade our immigration system. I think our immigration system currently sucks. But we are not looking at the actual problems with how our society is working. We're just blaming immigrants.
And this is where reality comes into play, Butter Roll. You have to actually look at what the facts are, because even among illegal immigration, we have a net positive, even among illegal immigration. This is why we talk about you have to actually know what the facts are, and you have to be steeped in reality to have a debate and to have a conversation. Because if you aren't in reality, then there's nothing that we can tell you about, because you're wrong.
And we got jobs and houses for them. No one wants to do the jobs that they're doing. No one. Not for what places would can pay for it. Again, if farms paid living wages for the people that picked, not only would Americans still not do it, but it would cause the cost of those goods to skyrocket so much that people couldn't afford to eat. So then those places would have to reduce prices or reduce people, which means they would reduce the amount of stuff that they could actually farm in a season, which would cause them to go out of business.
People need to also get it through their heads that there is a harsh reality that unskilled labor is lower pay, and that people, especially people who come here to work, that they're still sending that money to their own countries, which is far more pay than what they would be able to get there, or any job that they might not be able to get there. It's just a reality that we live in. So to try to stand on a moral high horse with that is just I mean, you literally, you have no moral standing.
And no,
We've already established that you have no moral
American
standing.
teenagers do not need to get out there and get strong. They need to get an education.
And there's that child labor. I mean, you want child labor then? I promise you that people who have money, wealthy families, are not making their children go work. They're making them get an education.
Here's again for the people that are saying that we're defending the way our system works. We're not. I am not defending the pay that these immigrants get in these jobs. I'm not defending any of that. I'm saying stop blaming the immigrants for it. It's not the immigrants' fault that they are that that in order to survive, these farms and construction companies need to pay them below minimum wage in many cases in order to be able to afford to work in their own, to stay functional.
You know, somebody brought up a good point. That is a very good point. Many of these jobs are not teenage jobs anymore. You're working heavy machinery, and they will not employ children with those jobs.
Our young men learn honest working character. No, they don't. Because again, that's a whole different problem. The problem with our job market, the problem with our our company system, our business system, is they don't care about the people. That's why you're seeing Gen Z not working hard, quote unquote. That's why you're seeing it, because they know that the company they work for doesn't care about them. They could work their ass off and be fired the next day. That's what businesses have shown them, is it doesn't matter.
And do you, I mean, how old are you, Butter? Like, do you think that people are going out and hand picking berries into buckets? Like, do you honestly think that that's how farming works nowadays still?
I've worked since I was 13. We're looking at 34 years now. So what? Probably with your mommy, Mr. 305. The wonders of competition? No. Not without regulations. There is no competition. That's the problem, is there's none. Employers will have to offer higher pay and benefits to get limited capable employees, and the prices of everything will go up. There's a reason that they have to do it. These farms are not hiring immigrants by choice. No, I don't want slaves. I want people to get paid a living wage.
You seem to think that when the immigrants are gone, that Americans will magically take these jobs. Why don't you go ask some farm workers if that's happening in red states where they're losing their immigrant population?
Exactly. Take a look at the farmers, ask the meat packers, ask people in construction and hospitality, all of which have been hurt by this.
Go to a nursing home. Ask a nursing home what they're going to do when their Haitian and Filipino workers are gone, where they're going to find workers. Ask some farmers in Florida how that's going for them, or construction work, or specialized construction work that are disaster rebuilding groups.
Not to mention, why should we want humans to keep doing some of those back-breaking jobs? Most of the people that I know that worked construction their entire life are in their 50s and are practically immobile. Like, why can we not actually make life better for people?
And that's one of the core differences between right and left right now. You know, the left is saying that we do need these people. we do want reform because we don't want people to live in the shadows, but we want them to have a pathway to being here legally. And our system is decades behind in our laws to get that done. Whereas the right just wants them all gone without any plan or solution that is steeped in what is reality of what would happen if we lose this population of people.
And yes, Tav, you have been saying that. I see your stuff. There's just I'm reading 3 different chats at the same time, so I'm sorry if I don't read your stuff. I promise I'm reading them all. New here, I don't know the etiquette. You got no etiquette. You're good. You're good. It's just, you know, we're having a conversation while talking everywhere. So, because I got TikTok, I got YouTube, and I got Twitch all at the same time. So I'm trying to read them all.
Mike, could you do me a favor and drop me down? I have an appointment I've got to get to.
Yes,
I have to
sir.
leave a bit early today. Thanks.
Have a good one.
Thank you. Thank you, Books. Thank you, everybody in chat. Thanks a lot.
By the way, who is the other person? You mean Scott? That's Scott. And by the way, for those of you that are sitting here going, oh, the socialist one in Michigan, El Sayed's not a socialist. Hey, Yuza. Like he's straight up, he's like, he is a capitalist. He just wants people to be able to afford to live. I don't mind capitalism as long as it's regulated. Very well regulated.
I mean, the right is literally pulling propaganda from 50 years ago and just putting it on repeat.
Regulated capitalism is not socialism. That shows that you literally don't know what you're talking. But I enjoy capitalism? No, I mean I don't. I think all businesses should be paying everyone who works there a minimum a living wage, if not more than a living wage, because they're the reason that profit exists in the first place. I don't think there should be billionaires. I don't think there should be 100 millionaires. I think we should be taxing, you know, the wealthiest people when they make above $10 million in a year. I think we should be taxing them like 90%. Now, is that the world we live in? No, it's not the world we live in. But
yes, that is true. Most people in this country cannot read past a 3rd grade education. Most people in this country cannot read a paragraph and pull out any sort of critical thinking from it.
and yes, the fact that the reality is most of the wealth in this country, most of the money in this country is in wealth, and that wealth never gets spent. They take loans out on that wealth and never pay taxes on it. It just sits there and keeps making money. It never actually spend it. It never goes anywhere. It's literally how the rich live. Elon Musk didn't buy Twitter. He loaned Twitter. Anyone can do it? No, they can't. Not if you have no wealth, you can't. You really believe?
Yeah, reading comprehension is what we're talking about. So you may have the ability to read, but people's reading comprehension level is on average not above a 3rd grade level.
Well, yeah, he was forced to buy it because he made an offer that was accepted, and then he tried to get out of it. But he was never planning on paying that with cash, nor did he. He took out a loan based on his wealth. That's literally hoarding, and apparently a lot of people are fine with it because they think that they will get it as well. Hello.
Hello, can you guys hear me?
We can.
Great, thank you for having me. Good morning.
Morning.
So I just wanted to jump in and I can let you finish your thought, but about the consolidation of wealth, where these people have collateral to put against, right? And it's about perception of how that collateral will do. So they don't have liquid, they don't have money, and they're subsidized a lot of the time, and the laws are favored towards them through loopholes and other things. So not everyone can do it, and that's a misconception. So I just really wanted to get out there and say that because it's frustrating.
Yeah. And no one says healthcare is free. I don't know why you guys can't understand it. No one is actually saying that healthcare should be free. It never could be free. We are saying
I wanted to,
single payer
well,
health insurance.
so I hear a lot of people say that where their tax money is going. War, ICE, projects that are about, glorifying Washington, D.C. But our money could be going with the percentage that we're paying towards healthcare. And why isn't that the primary focus? Because we all need to live.
I keep hearing it from the left. No, you don't. That's what your brain hears, but you're not actually listening to what they're saying. No one who is saying that they want universal health care, or even if they use the word free health care, if you actually listen to what they're saying, they all know it's not free. They all know that our taxes would go to a fund that would pay for it.
Imagine we received taxpayers an invoice at the end of the year of what the government spent our money on, you would be appalled. And that's when people would be in the street.
Do I agree that human rights shouldn't have a cost? No, I don't agree that human rights shouldn't have a cost. I think human rights should be affordable.
I mean, human rights are inherently a human right. Like that means that you have a right to them just for being human.
How can you attain life, right? Life, liberty, and property. Look at the order they're in. How do you get life without healthcare? I mean, it just appalls me.
Sounds like free to you, but it's not. Affordable isn't free.
Is the right to first speech free?
Accessible doesn't mean free.
Yeah, and that is inherently what human rights means. That like no matter what, you have the right to have food. Do you have the right to have any food that you want? Or no, maybe probably not. I mean, that like, that's like saying people in prison don't have the right to food, or people who are born with the inability, to progress past a mental age of 3 don't have the right to be fed. It's a human right. Then your most basic needs, water, food, healthcare, yes, healthcare, so that you don't die because you don't have access to medicine like insulin?
And to piggyback off what you're saying, without those things, how can we, I mean, we see progressive societies again around the country, but we're also looking at why we don't have those things, right? We always have excuses. There's always an excuse. And somehow it's always one reason for that excuse. Immigrants or something. But we always have money for everything besides what we actually all need. All.
Deserve a doctor? No, we all deserve to be able to afford it. Something that is a right needs to be set up in such a way that everyone in this country, by the very nature of their existence as humans, should be able to have access and afford going to the doctor.
Yeah, and in my opinion, yes. That means that if you don't have insurance because you lost your job and you get into a major car accident, that you have an expectation and a right to go to the emergency room and be treated.
And
I mean,
Butterwell,
right now, sorry.
I just
I was going to say the catastrophic laws right now are such that you go there and then a majority of Americans end up in bankruptcy, right? And they wait until the last minute where they're on death's doorstep or they're in a catastrophic event. And then that ends up being a bigger burden onto taxpayers in the long run.
And in terms of human rights, I don't believe that documented immigrants and undocumented immigrants are different. Again, human rights. Now, do people that are undocumented have to like, again, do I think we need to change our immigration system? Yes. But in terms of human rights, no.
And that is such a disgusting comment about people who are obese. There are a million life choices that are wrong that can cause people to have poor health outcomes. Does that mean that the teenager who was riding his skateboard without a helmet shouldn't get emergency care because he crushed his skull open? I mean, give me a break. This is so ridiculous.
In reality, there's a legal standard. Yeah. And the legal standard is they are undocumented immigrants, not illegal immigrants. And you can't seem to get that either.
It's not a silly example. It's one of a million examples. Should somebody who smoked for 30 years be able to get treatment for their COPD?
So also when he brings upon legal standards, for example, if you're an alcoholic and you're on the list to get, on the donation list, you're still going to have to go through those things where you have to quit. You're not just getting a liver. You're not just getting these organs, so there are procedures and protocols that are legal, as they say. And when it comes to catastrophic, insurance, everyone deserves to have their life saved, whether or not you put a label on them. And that label changes. And I think that it's a lack of abstract thinking when it's always immigrants, communists, socialists. It's always one problem for their, one conclusion for their problem. It's not just one thing.
And
it's a systematic problem.
And the problem is our current insurance system. We call it healthcare because health insurance is part of our healthcare, unfortunately. The problem is our insurance system. The problem is that in order for us to get healthcare, we have to go through a company. We have to pay a company whose goal is not to make sure we get healthy, whose goal is not to make sure that we get good quality healthcare. It's to make as much money as they can for their stockholders.
That couldn't be. I'm sorry. I said that couldn't be more true in the sense that these companies, so for perspective, these companies have 20% of their claims denied. and they have a whole set of attorneys that are looking through your documents, making sure they can find a way to deny your claim. That's their entire job. And at the same time, the insurance companies are hiring potentially doctors to intervene between the care of your primary doctor and you. So when your doctor has a plan and says, hey, I think this is the best course of action, the insurance company from somewhere is telling your doctor who knows you, no, we're going to put them through a different course of action. How that's not the unauthorized practice of medicine, I am still trying to wrap my head around.
And Sparky, none of us think that declaring something a right makes it immune to scarcity. What it does do is make it so the government looks at it as something that is extremely important. So, like, what would that mean in terms of doctors? Which again is probably the problem that even we're still dealing with in our current system, is a lack of, especially PCPs. We put money in to getting people to get an education and become PCPs. Right now, because we do everything from a privatized and capitalistic mentality, all we do is say, you should go get this job because it pays a lot. No. Why isn't food a human right? I think food should be a human right.
It is.
I mean, I think of it this.
All countries.
Sorry, you go ahead.
Food is a human right. I believe in probably every single country in the world except for us. So start looking outside of the US and see what the rest of the world is doing and thinks is a human right too.
I think housing is a human right. I think energy is a human right.
So I think what underlies what you're saying in terms of rights is that the institution or the government should be making it easier for us. Look at like how people fight for the Second Amendment. We're trying to, make reasonable gun legislation. Everyone's like, no, you can't make it harder. You can't make it harder, but we can make it harder to access healthcare. We can make it harder to access education. We can make it harder to access voting. We can make it. I could go on, but the Second Amendment, oh my God, we can't make that harder.
Yeah,
it's just wild. What's more important?
There will be one company to capture 100% of the money from the. No, that's not. No, one company doesn't capture all of the Medicare money that's out there currently.
I was gonna respond to one person comment, and then I'm gonna have to go.
Okay.
But somebody was asking, why are we even arguing this? And we kind of stated it a while ago. But this is where, I think many of us are frustrated on the left with how the right has moved and how the differences between the 80s and 90s versus now is into play with politics. Is that at a fundamental and core level, we are not agreeing with things anymore. And I could never vote for a party that doesn't believe that people should have their most basic needs met and that people should have access to their most basic needs. And unfortunately, that is where the Republican Party is, and many, maybe not all people in the Republican Party, but generally where the majority of the Republican Party is lying right now and the laws that they are creating.
Sparky, what do I consider a human right? What is my definition of a human right? Something that being just the actual act of being a human gives you access and the ability to afford by being a human. That's what I consider. That's my definition of a human right. Is the only requirement to have access to it is being a human.
And I can't have a conversation with somebody who thinks that I don't deserve the right to vote because I'm a woman.
And again, there are things that are constitutional rights that I don't think are human rights. That we as a constitution have decided that everyone who is an American has access to or should. Maybe there are obviously ones that don't think women should, but we have access. Voting is a constitutional right. I don't think voting by its very nature is a human right.
And I think that distinction is really important, because we don't need the right to vote to live, right? To go about our daily lives if we, God forbid, come into something, but we need healthcare. And I don't understand these people's position of either they're in really great positions or they don't think that they can come into the position of catastrophe. That they think it's not going to happen to them. Because if I had a choice right now for my health or my right to vote, right, if I just had that choice.
Chris, there is the ability, just like with everything, that there is an argument, and it I could, not every state doesn't allow you to vote if you're a felon, but there is an argument in place that says that by the very act of doing something that causes you to be a felon, you are paying for it, and part of paying for that is maybe not having access to something like voting. And again, there's people that think that women don't have a constitutional right to vote or shouldn't. So that's just a whataboutism. And again, you can take anything I'm saying and compare it to current society, and yeah, it's there are issues with it. Our America has issues that we need to fix. Should felons get the right to vote? You know, should someone who unalived people knowingly have the right to decide who runs our country? That's an interesting question. And I can see all of the sides to it.
I mean, on paper, we have a felon in the office right now.
Also true. Should a felon be able to be president?
You know, and one of my biggest things about the current Republican Party is that they are attracting, in my opinion, the worst of the worst. They are attracting the groups that don't want certain people or certain groups of people to have the right to vote.
I do agree with the statement of once they complete their sentence, yes, but I also have an issue with the way we sentence people right now. So again, if you want to take it by its very, very finite point, yes, they shouldn't vote while they are currently paying. In my opinion, they shouldn't be able to vote while they're currently paying for their crimes. And once they've paid for their crimes, they should be allowed to vote again. But I also think that requires us to fix our judicial system and this whole two-tiered system that we are experiencing before that could actually come to fruition.
I not only agree in that respect, where in terms of there's a crazy problem with sentencing. I look at this example in terms of when two states actually sued each other. I think it was Nebraska and Colorado, where in one state you are incarcerated for 10 years, let's say, for an example, and next door you are making $1 million from selling THC products. State to state, right? One border. So in one state you're incarcerated, and another you're a entrepreneur.
Some say the left is attracting Islam. Well, I mean, the right is mostly built up of people that hate them and their existence and think they should be kicked out. So why wouldn't the left be attracting people of a marginalized community in this country?
I mean, it's pretty obvious, but the person who's saying it, but they also don't know what Islam is or what the majority of people who follow Islam believe, because most people who are like that probably think of, you know, extremist Middle East, like I don't know what, in Afghanistan or something, and that's not what the majority is.
We are, Chris, a representative democracy. We are a republic in the sense of we democratically vote in representatives that use a constitution to decide how to run government. We are all of them. They're different words for different parts of how we do things. We are a democracy. We are also a republic. We are also a constitutional republic. We are representative democracy, where people, us, vote in representatives. Senators were not, you're right, they were not, but then we had a thing called an amendment. So I don't know why you're talking about what we were and weren't. We are now. Hey, Fina.
The old interpretation of the Constitution that the Supreme Court made doesn't require it free or not free, but like a right to food or housing or things like that. That doesn't mean that the interpretation of it can change. That doesn't mean that we can't change the Constitution either.
The 17th Amendment is the amendment that made it so our senators were voted in instead of chosen by states' legislatures. So they weren't actually chosen by governors; they were chosen by state legislatures.
We also have the 18th and the 21st Amendment, right? Abolishing alcohol and then allowing it back in.
You can change. We know you can change the Constitution. No one here said you can't change the Constitution. It's a primary win, not an actual seat win. Yeah, we know.
I think that guy's just stating facts that he just learned this week.
It's called an amendment, my guy. An amendment to the Constitution.
I literally just gave him an example. It just went over their head. Just gone.
And again, do all of you agree with it? Does the new amendment go against what the founding fathers wanted? Possibly. It doesn't matter. In the end, it doesn't matter what the founding fathers wanted. It matters what they said. It matters what it says in the end. They didn't want. That was weird.
I think prohibition's a good example where it's like, do you think that they would have thought in their document that it would have been about alcohol anywhere in there? Maybe. I don't know. But like, that's a great example of how the amendment can work.
Yeah.
And there are different interpretations of the Constitution. That's why we have a Supreme Court.
Look at Roe v. Wade. You know, I mean, that's another example of, okay, the court in the 70s interpreted it this way. The court now, I mean, it just, if you don't understand that, then you need to go back to basic like law.
Yes, Abdul won his primary. Yeah, and again, you know, when the Constitution was written, slavery was a thing, was okay. Won't vote for Islamic candidate. What does his religion have to do with anything? My guy. I don't vote
You know, I want to bring up an example today that I read. I'm originally from New York, but in the Staten Island Advance, which is our local paper, they are getting a group together to prevent Mamdani from being at the 9/11 ceremony.
Yeah, I saw that.
which is wild to me because he was 9 years old. I witnessed it firsthand. I don't want to get into it, but it's one of these things where how are you blaming Mamdani at all? Where does he come into this picture aside from maybe his religious standings or his background?
Just real quick, can we block M real quick for that?
Yep.
We don't. Thank you.
And I'm going
Sorry.
to say while I'm getting rid of him that the same argument could be made for Christians at this point.
Correct.
And
Correct.
again, this is coming from someone who is a Christian and goes to church every single week. You could say the same thing. None of you have deployed to the Middle East. So this isn't the Middle East.
Neither has our president.
Most of this country hasn't deployed to the Middle East.
You do know that there are all different kinds of people who follow all different kinds of religions who are American, and they have since America was even a thought as a country.
Yeah. Papa Shug has, and he agrees with me. And how you doing, Shug? You know, people's interpretation of the Second Amendment. I completely disagree with people's interpretation of it. I think the purpose of the Second Amendment had to do with state militias. And that's based on reading the discussions when they were putting it together. Aw, my guy, how's that Tiny D energy coming for you? Ice is not important. We survived without ice for a long time.
All right. Well, I do gotta.
I do
get
too. It's the
moving.
end of my thing. Guys, thank you so much for hanging out with me. Thank you for coming up.
Thank you for having me.
Absolutely.
Have a great day, guys.
Yep. Everyone who gave and everything, I appreciate it. A new episode went out this morning. If you're part of Tennessee, make sure you get out and vote tomorrow. It's Tennessee's primary tomorrow. I'll see you tomorrow morning. You guys are amazing just the way you are, and I love you all very much. Stay safe, stay healthy. Remember to sing, laugh, dance, smile. Do something that makes you happy. Bye, guys. Goodbye. Goodbye, YouTube. Goodbye, Twitch. Thank you, guys. Thanks for coming in here and hanging out. I'll see you guys tomorrow morning. Bye.